Hello. I hope everyone is doing well. Thanks for coming in. I just wanted to do a last minute before update. Today is Saturday, November the 8th. My surgery is Monday, November the 10th. And I am not going to lie, I've overdone it for the past week, um, trying to um, get ready for my surgery, trying to make a little extra money to put away, and trying to get my apartment in maintenance downstairs. So they are coming in next week to replace my bathtub because apparently whatever issue is going on is with the bathtub that is affecting. Sorry, I don't know what happened. It just buffered on me. Um, but I wanted to just give a last minute update on what needs to happen before the surgery on Monday. So, the antibacterial, it keeps buffering. This is a generic brand, the surgical scrub. So I am to bathe or shower with this um, starting 4 days prior. So I did it on Wednesday. And Rich Player, hi, good to see you. Joel, good to see you. Thanks for coming in. Um, can you be a mod? I don't have any mods right now because my channel is still growing. But if you subscribe to my channel and as we grow, absolutely. Um, so the surgical scrub, you do whatever the doctor tells you prior to your surgery. They told me starting 4 days before. So I do like a half a bottle that I'm operating on. Um, so yeah, that's we're on it. They may do it. I have to do it the night before surgery is scheduled for 7 a.m. So I have to be there at 5:30 a.m. They do kind of later, so they don't start as early. So it's going to be a little simple part. Um, but I do have to be there at 5:30 and have to shower with the surgical scrub before the surgery. More than likely, um, well, this is my third C4, 5, and 6. So this is a much bigger surgery. If both birds, I know I have compression um, on C, I believe it is. So they know they have to relieve that compression. Um, and then the type of surgery, it's they're tan, then what all they're gonna have to get in there. Like, they cut my hair. Um, so come in vision. I had I think 21 staples last time. So I imagine since this is a bigger surgery, it's going to be much more. But and since this is my third, we've kind of established that relationship. I am not going to put up with any BS, I guess. Um, I know that was, I don't know why it keeps buffering. I apologize for that. Is everybody able to see me okay? Is it buffering for anybody else? Obviously, you're not going to be able to lift my knockoff tumbler here. I'm not sure is going to be your friend. Um, so you want to get a bendy straw. Um, what else was there? Something else that I chart or Athena patient portal or what way that you communicate with your doctor. Make sure that you're checking in. What's up? Okay, I think I'm back. Give me a minute to. Um, make if you plan to not plan back, stay clear whenever you're able to. You need a walker or a wheelchair, or if you have a cane, um, or whatever it is that you need to leave the hospital. Make sure you have it. Make sure you have your ride in place. Make sure they know where you are, where they're going to be to pick you up. Make sure that they have the vehicle. You're not going to be able to get into a big old 4x4 truck. Make sure that they have the right vehicle. I guess my son's taking me. We have a car, easy peasy, get in and out, no problem. Um, and these are just kind of little things that you don't think about when you are in that state of mind. That state of mind being pain, recovering from surgery. That's another thing. Make sure that if they send in any prescriptions for you, um, that you get those filled prior to. Um, my doctor sends them right to the hospital pharmacy, and my son just walks down there and picks them up when they're ready. It's nothing. We don't have to go to pick them up anywhere at a pharmacy or whatever. It's just walk to the pharmacy, pick them up, and that's it. Your hospital may not have an outpatient pharmacy. So, if you need it to be sent to your pharmacy, make sure you have that in place so that when you get home, you have your medications, your pain medications, your muscle relaxers, your anti-nausea medication, all that stuff that they're going to send in for you. Um, Tylenol. Make sure you have Tylenol because you can't take um, ibuprofen, Motrin, Aleve, anything like that. You can't take that. You have to take Tylenol or acetaminophen. So make sure you have that. Um, are there any questions about the surgery? Anybody that's going through the surgery that has any questions? If you're watching this on replay, feel free to leave me a comment or question below. I'll try to answer it. I will have my phone with me or my tablet with me, so I'll may be able to um, do a live after the surgery. I don't know. I'll be bored sitting there in the hospital. Um, Probably be um, antsy, ready to go, but I have to stay the 2 days. Um, if you weren't able to see the video about the neck brace, make sure you go back and watch that. Um, and yeah, if you have any questions, let me know. Um, I do have um, a lift chair here. I bought last time just off of Amazon. I bought a reclining lift chair, um, and I will put that link below. And it was really funny because it came literally in pieces. Um, and we had to put it together. It sat in the box for several days because there was no instructions on how to put it together. There was no online support. Amazon was no help in putting this chair together, and it was literal pieces. And when I say pieces, I mean we had to build the arms of the chair. We had to put in the mechanisms for the massage and the lift and the reclining and the slats and the footstool and put the covers on, and it it was so frustrating. But once we figured out how to do it, and the only way we figured it out was I just obsessed over it, and I just thought of how would this chair have been put together had it been put together in a furniture store. Um, so it was like putting a puzzle together. I mean, the armrest, you literally had to build the armrest, each slat on the side, the thing in the, that goes down. The doesn't have a lever, but the buttons to control it. The side, I mean, it was like putting a puzzle together. And once I just sat and thought about it and obsessed over it, I'm like, we got this. So we put this chair together. Um, and it's basically just sitting in my room with junk on it right now. But we're going to get that to use. And some people sleep in the chair after their surgery. I like lots of pillows on my bed, so I prefer sleeping in my bed and prop up on the pillows. But you do whatever's comfortable for you. Um, More than likely, you will sleep with the neck brace on. And like I said, it's the hard brace, which I have right here. If you weren't here for the last video, I'll just demonstrate the brace that you wear. This is the hardcover brace, and it is flexible with Velcro, but you will wake up from anesthesia, you will have this on. More than likely, you will sleep with it and wear it, except for bathing, the only time you would take it off. Of course, your doctor has different instructions, so always follow the instructions of the doctor. I'm just telling you my experience and what I did. Like I said, this is my third surgery, so I know what to expect, but yet, they may tell me something different this time. But this is the neck brace that you'll have on when you wake up from anesthesia. It is adjustable to fit you, but you don't have to worry about those adjustments. Your doctor or nurse or whoever it is going to have it adjusted for you. And like I said, you will wake up with it when you come out of anesthesia. You will have this on, and it fits just like this. Okay. And I'm not going to tell you all the jokes that I made about it, of why I have it, but let's just say I've had a lot of questions about, why are you wearing a neck brace? Or what happened? You can tell your own story, but I had several. It does have an opening here so that if your incision is here, they're able to see it. If the incision is in the back, it is padded. The pads do come off with Velcro, so you can throw them in the washer. You do get extra set of the pads. I mean, it's not the most comfortable thing, but it's not bad, I guess. It keeps you from moving your neck from side to side, and keeps everything stable so that you can heal. They also, and I guess they'll follow up with me, I don't know, a bone growth simulator. I have not heard back from them, so I'm not sure if that's still a thing or not. Now that I'm thinking about it, it's some kind of device that I wear for like 30 minutes a day that's supposed to help with the healing of the bone, but I haven't heard anything else about it, so I'm assuming that they're changed their mind on that. I don't know. Maybe they'll give it to me in the hospital. I don't know, so I shouldn't speak on it. It just dawned on me that someone did call me about that. Um, so is there any questions, again, that I can answer for anybody that's going through the surgery? Um, I'll be happy to answer them. Like I said, drop me a comment below, or if you want to leave me a comment on the replay, I'm more than happy to answer any questions. Um, and these are questions as my experience, not medical advice, nothing like that. Like I said, this is my third time having cervical spine surgery, so this is my experience. When I first had my surgery, um, there was a lot of videos out there about the surgery, but on the medical side, what to expect. There wasn't anything really about the first person or the patient's perspective. So that's kind of why well, not kind of, but that is why I'm doing these videos, because um, I wanted to share my experience in hopes that it would help somebody else that is going through these surgeries. Again, it's my experience, my opinion, not medical advice. Follow the advice and directions of your healthcare provider. Um, but if I can provide any insight on the patient side, I'm happy to do that. So again, just to recap, the antibacterial soap that you need to do before your surgery. They told me to start it 4 days prior. Um, so they gave me like 3 bottles, and I used like half a bottle since Thursday. Um, and the bendy straw will be back. You need a bendy straw. And I bought hundreds of them last time, so I have. Let's see, anything else that I can think of? I think that's all that I have to remind. If there's anything else, I will pop on and let you know. I may try to do another video before the surgery on Monday. I'm not sure, but it's possible. Um, but yeah, my surgery is Monday the 10th at if you don't hang out, please subscribe. And probably kind of boring area in the Boston area scenes and beaches and stuff like that as I am able to get out. Um, I am working on some other projects that I hope to record. So, yeah, look forward to doing those. And I will link the chair that I have, and also the leggings that I have that have the pockets in them, because they are lifesavers. If you, because I can't do buttons or snaps or zippers or anything like that because of the pockets in them. So yeah, they're great. Are there any? Is anybody that's contemplating getting it, recommended they get it? Is there anything else I think of or anything changes? Just to recap, make sure you're in contact or your hospital, you're in contact or your hospital to see if there's any changes. Time you should be notified the day before, if not soon, or if not sooner. Mine not soon, or if not sooner. Mine was Friday because my surgery is Monday, so they told me Friday what time to be there. So make sure you're back with the hospital or doctor's office to see if there's any last minute changes. Make sure you stop stopped. Um, stopped. Um, make sure that you have your groceries, food, what have you. You're not going to be able to cook your groceries, food, what have you. You're not going to be able to cook. So I just have stuff I can pop in. So I just have, stuff I can pop in the air fryer or sandwiches type of thing. Script sure that you have your wound care supplies, and they will tell you when to change your dressing on your and then when you go back for your 2 week and then when you go back for your 2 week follow up, they'll take out the staples or sutures or whatever they have. Like I said, last time I had 21 staples, so they were quite painful to remove. I'm not sure how many I'll have this time, but I'm sure it's going to be more. Um, I think that's all the reminders that I have. But again, if you have any questions, leave me a comment below. If you're watching it on replay and you have any questions that I can answer, again, as my opinion, my experience, not medical advice, please let me. I'll probably go online, maybe do a short before the surgery. Um, and then after my surgery, I will um, do an update. So if there's anything further for me, I am going to sign off for now. I hope everyone has a great day and enjoys their weekend. And like, subscribe if you haven't already. Leave me a comment. And I enjoy making another video to update everybody and getting back to our fun videos. So I appreciate y'all being here, and I will see you all later. Thanks, guys.